Many patients today think of a facelift as meaning lifting of the entire face. That is, they think of a facelift as being not only lifting of the cheeks and the neck, but also the eyelids and the forehead. Now, in fact, from a surgical perspective, surgeons think of the facelift as the cheeks and the neck. We think of it as an eyelid lift or blepharoplasty for the upper and lower eyelids. And if we're going to raise the brows and the forehead, we call that a forehead lift. Now, the reasons that you might like to consider a forehead lift are if you have really saggy lateral eyebrows, which gives you a tired, sad, angry, unhappy look. In addition, if you have really deep wrinkles between the eyes or in the forehead, these can be substantially improved with a forehead lift. We can do forehead lifts in several different ways. One way is the so-called minimally invasive or endoscopic forehead lift, in which we make 4 or 5 very small incisions, about an inch long, up in the hair. We can then elevate the forehead skin, and at that point then we raise the brows, not as much as we can, but just as much as we need to give you a more youthful look. And in many cases we can also reduce the muscle action in the muscles that are here and here in the forehead to decrease the creases or furrows in the forehead. Now, sometimes if you have really thick skin, or you have a lot of redundant or extra skin in the forehead, and if you have a low hairline, then we might do a different type of lift, which we call an open forehead lift. And again, there are different variations on this, but in this case we make one longer incision across the top of the forehead so that we can elevate the forehead skin and also resect or remove some of it. These procedures, some of us feel, can give you a bit of a longer result and an even better result. But certainly, especially for younger patients who don't require too much lifting, the endoscopic or minimally invasive lift is very satisfactory. And finally, although we don't use it all that often, particularly in some men who have significant male baldness, then we can sometimes make a little incision just above the eyebrows to lift the eyebrows themselves. The incision, particularly in light-skinned individuals, heals up very, very well. At the end of the day, whichever procedure is selected, our goal is to raise the eyebrows just that amount that takes away that heavy, hooded feeling that one sees with lowered eyebrows, and also improve wrinkles in the forehead. In this way, forehead lifting can be a very rejuvenating experience for many patients. And another great thing about it, it has a tremendous longevity, keeping your brow position where we placed it for years and years to come.